Hello, I am urologist Omer Erdamakaya. Today, I will have a short video presentation about kidney swelling and kidney enlargement during pregnancy. Swelling or enlargement of the kidney during pregnancy usually occurs in the last 3 months of pregnancy. These patients present to our clinic, usually with right side pain. The story in the patient is usually as follows. The patient applies to the emergency room with right side pain. Nausea and vomiting accompany. It is very severe pain. The patient goes to the obstetrician. When the obstetrician sees the swelling in the kidney and the patient has complaints, they send the patient to urology. How and why does kidney swelling occur? The swelling in the kidney is completely caused by the baby's head leaning against the urinary tract between the kidney and the bladder. There is a problem in the evacuation of the urine from the kidney, and the kidney swells, followed by the complaints of nausea, vomiting and pain. Generally, these complaints are more common in the first pregnancies. These complaints are much less in the second and third pregnancies. Because the body gets used to it, it can react differently because it is not used to it in the first pregnancy. In fact, in the last 3 months of pregnancy, first-degree swelling occurs in the kidneys and we consider it normal. Especially, there is a little more swelling on the right side than on the left. We also consider this normal. However, if the patient has complaints and symptoms, and more precisely, if this occurred quickly, the patient may also complain of pain, nausea, and vomiting. Generally, we recommend the patient painkillers, warm and hot applications, and position changes while lying down, which we call symptomatic treatment. But if patients continue to have pain, sometimes patients can go to the emergency room every night. The patient's eating, drinking, and mood may deteriorate. In such cases, we can place a stent called double J stent in patients. A double J stent is a thin silicone nylon tube inserted between the kidney and the bladder. This tube ensures that the urine from the kidney passes into the bladder in a healthy way. Under local anesthesia, we can place a double J stent in a 5-minute procedure. So, the pain of the patient disappears after the stent is placed. But we are trying to postpone this as much as we can. Because when we place a double J stent, there is a situation to trigger premature birth in the patient. It is very unlikely. I have never seen it so far, but it has its place in the books. We wouldn't want such a thing to happen. That's why we tell the patients, we advise them, and most of the patients recover and improve their general condition with symptomatic treatment. But sometimes we have to place a double J stent. Thank you for listening, best regards.